To Moving Beyond the Blueprint, an employer update around COVID-19, sponsored by the Alameda County Healthcare Services Agency and City of Berkeley for the East Bay Economic Development Alliance, or East Bay EDA, which is a 30-year-old regional economic development organization focused on a variety of issues from business climate to education and talent to regional economic development, land use, and many, many other issues as well. I'm going to be moderating tonight's event, and I'd like to welcome and thank you for joining us. As we get going, I want to go ahead and point out that we'll be offering this broadcast in multiple languages. And in fact, we're going to be having translation services available in American Sign Language, Cantonese, Spanish, and Vietnamese. I invite the interpreters to share the instructions on the upcoming slide on how participants can access the language rooms. And we will start first with our Cantonese interpreter, who can read the instructions on slide number 2.
Hi, this is Cindy Chow and the Chinese interpreter. And then so I'm going to speak in Chinese, right? Okay. 各位晚安，今晚我哋呢個嘅會議咧，將會係可以選擇廣東話頻道嚟到係去聽取呢個會議嘅整個過程。如果你係想聽粵語頻道嘅話咧，你見到嗰個嘅屏幕上面有一個地球嘅形狀，你點擊入去之後咧，你就可以留喺嗰度咧係聽取呢個嘅係中文頻道，亦都可以咧喺嗰度發問問題。多謝大家 ，Thank you。
Thank you very much. Let me ask our Spanish interpreter to share instructions for those seeking Spanish language interpretation.
Buenas tardes. El evento de hoy será interpretado al español. Para poder acceder a interpretación en español, en unos momentos vamos a activar la función de interpretación por Zoom. Al hacer esto, ustedes podrán ver un globo terráqueo en la parte derecha baja de su pantalla. Van a escoger ese icono y luego van a seleccionar el idioma español o Spanish. Luego pueden escoger Mute Original Audio para solo escuchar en español y no escuchar a voz más baja en inglés. Si están usando un diapositivo inteligente, por favor, seleccionen los 3 puntos o la parte que dice más o more para poder acceder a interpretación. En unos momentos se activará esta función. Gracias.
Thank you. Finally, let me ask our Vietnamese interpreter to also share instructions.
Xin chào quý vị, tên tôi là Tiffany và người làm việc chung với tôi ngày hôm nay là cô Lan Chi Lê, sẽ là người thông dịch viên cho cuộc hội thảo ngày hôm nay. Cảm ơn quý vị đã tham dự cuộc họp hội thảo và chúng tôi tối nay sẽ có thông dịch bằng tiếng Việt, tiếng Quảng Đông và tiếng Tây Ban Nha. Nếu quý vị muốn nghe được tiếng Việt thì xin quý vị nhấp vào quả địa cầu ở bên tay phải cuối màn hình, chọn cái ngôn ngữ là tiếng Việt Nam và quý vị có thể nghe được cái thông dịch ngày hôm nay. Và nếu mà quý vị không có muốn nghe những cái âm thanh khác, những cái tiếng nói của người khác thì quý vị có thể làm ơn mute original audio, tức là tắt cái âm thanh gốc đi và quý vị có thể nghe được tiếng thông dịch của người Việt mà thôi. Cảm ơn quý vị rất là nhiều. Thank you.
Thank you very much. As we move on to our next slide, I just want to go through a couple of housekeeping items. First of all, this webinar is scheduled to go until 7:30 this evening. All of you who are here participating are on mute. We are currently recording, and you should have had to accept and click on a button to acknowledge that when you were logged in. We are going to make a copy of the slides available within 24 hours on the Alameda County Healthcare Services Agency website. And we also are going to have some time at toward the end of tonight's broadcast for some questions and answers, some of which we've already received from audience members and others which I know are coming in now already through the chat or through the Q&A function, excuse me. And for those who are watching this live on YouTube, you can also put your questions into the YouTube live stream as well. And I think those are the main housekeeping items for the moment. So let me go ahead and continue on to our next slide very quickly, just to give you an overview of tonight's agenda. Tonight, we're going to go ahead and, hear a little bit about sort of local COVID-19 data, what's the latest information around that, talk a little bit about what it's the states moving beyond the blueprint, and then moving into state guidelines and what they currently are as of now. After that, we're going to have some brief conversations about local recovery and resilience. Also some tools and resources that may be interested to many of you who are watching. And then again, we're going to give you a chance to ask any questions that we might not have been able to cover in that portion. So thank you for having the slides get caught up. So again, here's how we're going to be running through tonight's topics and broadcast. Moving on to our next slide, I want to go ahead and just in a moment, we're going to turn it over to our three esteemed guests to say a few words. We're going to first be welcoming Supervisor Keith Carson, who's the president of the Alameda County Board of Supervisors representing District 5. Along with him, we have Colleen Chawla, the director of the Alameda County Healthcare Services Agency, and Lisa Warhus, the director of the City of Berkeley Public Health, Housing, and Community Services Department. I'm going to go ahead and first turn it over to Supervisor Carson for a few welcoming remarks.
Just a reminder to our panelists to please speak slowly because of our interpretation.
Thank you, Stephen, and good afternoon and good evening to everyone. Thank you for giving me an opportunity to speak with you tonight. I'm Keith Carson. I presently serve as the president of the Board of Supervisors for Alameda County, serving District 5. Which includes the cities of Albany, Berkeley, Emeryville, Piedmont, and a third of Oakland, including West Oakland and North Oakland. I also have the privilege of serving as the chair of the East Bay Economic Development Alliance, which is the largest business association in the East Bay, which covers Alameda and Contra Costa County, and includes representation from business, government, labor, and education. First off, I want to start by thanking each and every one of you for doing your part to keep our community safe these last 15 months. I know that it's been hard as a business person. I'm a former business person myself. I've almost had as many years in the private sector as I have in the public sector, owning a few small businesses, medium-sized businesses, since the city of Berkeley is a part of this, starting the Berkeley Flea Market, all of which have been rewarding in some way with me, and owning a couple of small cafes as well along the way. And so the difficulty that many of the businesses have been challenged with, I can only imagine what it's been like on top of the challenges we have each and every day.
Supervisor
Last week,
Carson.
as our state moved to fully reopen, I know that many of you are still working to bring your businesses back. Hopefully now that all the guidance has aligned both locally and at the state, you're able to have some clarity in terms of the reopening. And tonight you'll get further clarity in terms of your ability to reopen. And hopefully some of the questions you might have will be answered as we continue to navigate our way through this worldwide pandemic. East Bay EDA has embarked on a regional economic analysis and report. We're calling our report East Bay Forward. I'm hoping it can serve as a regional economic strategic plan, a roadmap on how we build resilient and sustainable economic recovery. If you're interested in the work of the East Bay EDA, we're hosting a State of the Economy just this coming Wednesday with Dr. Christopher Thornburg of the Beacon Economics, in partnership with the Industrial Association of Contra Costa County, on this coming Wednesday, June the 23rd at 10:30 a.m. on Zoom. So you can even register for this free event at www.eastbayeda.org/events. I want to thank all of you for taking your valuable time this evening as we try to move through impacts of COVID-19 and towards a future of economic recovery right here in our own backyard. Again, thank you for taking the time to be with us tonight.
Thank you, Supervisor Carson. Just a reminder to all of our panelists, please speak slowly. We have 4 different languages that are being interpreted and they take some time, so please speak slowly. Thank you.
Good evening, everyone. My name is Colleen Chavla, and I'm the director of the Alameda County Healthcare Services Agency. Thank you so much for joining us tonight. Tonight, our panelists will offer guidance and answer questions as we explore what's beyond the blueprint. We've experienced many new and challenging events since early 2020, when in January, our Department Operations Center activated for a novel coronavirus, and in March, our county activated our Emergency Operations Center for COVID-19. It's taken many hands working many hours to fight this deadly disease. And I want to take a moment to thank all of you for the efforts and sacrifices that you have made since the beginning of this pandemic. I also want to recognize our Healthcare Services Agency staff and partners, including the City of Berkeley local health jurisdiction leaders, healthcare providers, frontline and essential workers, community benefit organizations, and faith-based leaders whose work and support have been critical throughout the pandemic, helping us turn the corner to better days. I also want to remind our viewers that the pandemic is not over, and we pledge our continued vigilance for ongoing pandemic response to protect the health of our residents. Our agency is planning for the next phase of our county's pandemic recovery, and tonight you will hear more about that plan from the Alameda County Health Officer, Dr. Nicholas Moss. I look forward to continued collaboration with our community partners and stakeholders moving forward through this pandemic together.
Thank you, Supervisor Carson and Director Chavla. I concur with everything that everyone has said so far. I want to especially thank Alameda County for our very strong and aligned partnership throughout the length of this pandemic thus far. We have worked very quickly to respond and have simultaneously managed to be in strong communication with each other the whole way through. I also want to thank the City of Berkeley, both the staff and the leadership who have been fantastic through this response, and the community members who really did their part with masking up, holding distance, and now getting vaccinated. All actions that helped us to get to where we are at today. And while we have reached a phase in this pandemic where there is some cause for celebration, I also want to encourage us to keep a place in our hearts for those we have lost, those who have lost loved ones, and people in our country and in the world who are suffering from the impacts of COVID-19. This evening will be largely focused on the county as a whole. For those who have joined us tonight who wish to get more Berkeley-specific information, I encourage you to attend Mayor Jesse Araguin's virtual town hall on Monday, June 28th at 6 o'clock. Information about this town hall and how to access it can be found on the mayor's website, jessearaguin.com.
Thank you to everyone for their opening remarks. As we get ready to introduce our panel, we're going to have, as you can see, three folks here this evening. The health officer for Alameda County, Dr. Nicholas Moss, the health officer for the City of Berkeley, Dr. Lisa Hernandez, and also Eileen Ng, the policy director for the Alameda County Healthcare Services Agency. And I know we want to get right into things, so I'm going to be turning it over to Dr. Moss to get us going into the meat and substance of what we're here for tonight.
Thanks, Stephen, and good evening, everyone. Glad to be here speaking on this topic to you all. If we could go to the next slide, please. And one more. So I'll speak briefly about the COVID data as it stands today in Alameda County, but just a little bit of background. I know we've all been living in, COVID land for a year and a half now, but as a reminder, it's a respiratory illness that can range from mild to very severe and even fatal, caused by a virus often called SARS-CoV-2. And it's mainly spread through the air from person to person when an infected person coughs, sneezes, talks, or even breathes heavily. And we know that people without symptoms can spread COVID, which is part of what has made the pandemic so difficult to control. Common symptoms are flu-like symptoms, fevers, chills, muscle aches, cough, or even just common cold symptoms, a runny nose, congestion. Sometimes people have more unusual symptoms, loss of taste or smell, or they could have gastrointestinal symptoms, nausea, vomiting, and diarrhea. And as I mentioned, it can be very mild, and in fact, some people don't have any symptoms that they notice. The virus has not gone away and the pandemic is not over, although we are fortunate to be in a place where we can remove many restrictions and reopen some of the remaining things that had been closed. Next slide, please.
We need to switch interpreters real quick, Dr. Moss. I'm sorry.
ASL interpreters, please switch.
Appreciate the hard work of our interpreters.
You can carry on, Dr. Moss.
Thank you. So this is a screenshot of our county COVID dashboard. You may be familiar with this, has lots of information about what's going on with COVID now and what has happened really throughout. Almost 90,000 total cases have been reported in the county, including Berkeley. And we know there's more infections that were never diagnosed and never reported. There have been nearly 1,300 deaths due to confirmed COVID in Alameda County. And what you can see in the middle of this figure is the daily reported cases. As some of you may recall, we had a very substantial winter surge, and now we're at a place of much lower rates. We're going to zoom in on that real quickly. Next slide, please. So these are weekly case rates, cases among residents reported every week per 100,000 population, going back to last August. And you can see that huge surge. And one of the hallmarks of the COVID pandemic, not just here, but really across the country, disparities, different rates in different communities, with the highest rates among our Latino community members and our Black residents. But you can also see that really nobody was unaffected by the pandemic, especially when it was at its worst. And then again, you can see here on the far right that we're at very low rates compared to where we were. Again, putting us in a much better place to reopen. And part of that is vaccination. Next slide. So we now have almost 80% of our residents over age 12 with at least one dose of vaccine, helping keep those COVID case rates low. And 2/3 of our residents over age 12 are fully vaccinated. As you may know, there is not yet a vaccine for children under 12, although we're hoping that we'll have vaccine for younger age groups starting in the fall. So in sum, we're in a much better place than we were, and we're doing very well with vaccine, similar to the Bay Area as a whole. And the Bay Area as a whole is doing really better than the state of California and really most of the country. So we are very fortunate to be in a place where we have low rates and high vaccine, and are able to feel confident as we enter this next phase of reopening, where many of the restrictions fall away. So with that, I'll turn it over to my colleague, Dr. Lisa Hernandez from City of Berkeley.
Good evening. I appreciate being here to speak about Beyond the Blueprint and answer any questions from the business community. So we are now in the Beyond the Blueprint phase of the pandemic. And what that means is that most COVID-19 restrictions have been lifted by the state, except for specific situations where there are higher risk settings, including those where there are children and youth, especially those that are not vaccinated, healthcare settings, such as hospitals, skilled nursing facilities, and places where there are other congregate settings, such as shelters, whether it's a cooling or an emergency shelter or a homeless shelter. And both Alameda County and the city of Berkeley are fully aligned with the state lifting of the restrictions. So what that means is that everyday life will essentially feel like it did before COVID-19 started here in the world. But some workplaces and industries may continue to have specific restrictions, some of which will be due to the requirements of the state, as I mentioned, or others may be due to operational needs of a business. But as I mentioned, the economy has fully reopened, and we will have to continue to still be careful because the pandemic is not fully over. And that means that we may need to use masking in certain situations. And again, those situations include settings where our most at-risk community members may be either living or present. Next slide, please. So this slide gives you an idea of what restrictions have been lifted. In general, capacity limitations and physical distancing are no longer required. Vaccine verification or indication of a negative test may be required in certain special situations, but in most events, it will not be required. When it's required, it is considered an indoor mega event. And I will let you know what the mega event is in a minute. It is recommended for outdoor mega events. Again, I will let you know what that really means in a second. Face coverings and masking, we are required to follow the state's face covering requirements, and traveling, we're following CDC recommendations. Again, these are the guidances for the general public. Employers and employees are subject to Cal OSHA's emergency temporary standards. So those requirements may be a little different and or more restrictive. Next slide, please. So for mask and face covering, it will be required dependent on whether you're vaccinated or not fully vaccinated. And fully vaccinated means that you have received either 2 doses of a 2-dose vaccine or 1 dose of a 1-dose vaccine like the Janssen vaccine, and it has been 2 weeks after your last dose. So if you're fully vaccinated, you are not required to wear a mask or face covering indoors in public settings or outdoors in public settings. If you're not fully vaccinated, you are required to wear a mask in indoor public settings, but not in outdoor public settings. Now, there are certain settings that it does not matter whether you're vaccinated or not, where you will have to wear a mask. And these include public transit vehicles and hubs, such as airports, schools and other youth congregate settings, healthcare and long-term care facilities, correctional detention facilities, and shelters, whether they're emergency, cooling, or homeless shelters. Next slide, please. So a mega event. These are events where if it's indoors, 5,000 or more attendees per day, that is an indoor mega event. An indoor mega event includes such settings as conferences, sporting events, nightclubs, live concerts. In those settings, proof of being fully vaccinated or having a pre-entry negative test is required for all attendees. Outdoor mega events are those events where there are 10,000 or more attendees per day. Examples include car shows, marathons, sporting events, and outdoor live concerts. Proof of full vaccination status or pre-entry negative test is strongly recommended for all attendees. And venues are required to make available masks for all attendees. And just a reminder, when we're talking about masks, attendees must follow the state's face covering guidance based on your vaccination status. Next slide, please. So what does it mean for us to align with the state? Well, essentially, Alameda County and the city of Berkeley will be referring employers to the state regulations and guidance for reopening safely. And employers should consult with their HR, their human resources department, and legal counsel for support on complying with Cal OSHA rules, interpreting industry-specific guidance, and determining what's best for employees, clients, and your business needs. What local health departments will be doing is focusing on mitigating outbreaks and providing general prevention guidance. Next slide, please. I will now have the pleasure to hand over the slides to Eileen Eng, who will talk about the state guidelines.
Thank you, Dr. Hernandez. So I will provide information on the California state guidelines for employers. First, I will cover the Cal OSHA COVID-19 Prevention Emergency Temporary Standards. So on June 17th, the Cal OSHA board approved proposed revisions to the COVID-19 Prevention Emergency Temporary Standards, also known as the ETS, for workplaces. Per the governor's executive order, the revisions took effect on June 17th. According to Cal OSHA, employers should implement the June 17th COVID-19 Prevention ETS as soon as possible. For those unable to implement the ETS immediately, the employer must implement or retain alternative controls to ensure the health of employees. If an employer is continuing to comply with the November ETS while implementing the revisions, Cal OSHA will not cite the employer. Nothing in the revised ETS prevents employers from implementing additional protective measures than are required, including the use of physical distancing and barriers. We encourage you to review the Cal OSHA COVID-19 Prevention ETS for all employer requirements. Cal OSHA has also developed resources for employers. They have an updated ETS frequently asked questions webpage. Additionally, Cal OSHA will be hosting ETS webinars for employers and supervisors. They have 3 scheduled for June and 1 scheduled in July. Please also contact the Cal OSHA Regional and District Office with employer-related questions.
Eileen, can you please speak more loudly?
Yes, thank you.
Thank you.
Next slide, please. So here are the key requirements in the updated Cal OSHA ETS. First is employers must establish, implement, and maintain an effective written COVID-19 prevention program that includes a system of communicating with employees about COVID-19 symptoms and how to access COVID-19 testing. Also, identifying, evaluating COVID-19 hazards, investigating and responding to COVID-19 cases in the workplace, correction of COVID-19 hazards, training and providing instructions to employees about COVID-19 and respirator use, face covering requirements, and engineering and administrative controls, such as cleaning and disinfecting procedures, making the written program available for employees upon request, reporting outbreaks and return to work criteria after a close contact, or if an employee has tested positive for COVID-19. Respirators must be provided by the employer at no cost for voluntary use by not fully vaccinated employees. A fully vaccinated employee or person is where there are 2 weeks after their second dose in a 2-dose series, such as the Pfizer or Moderna vaccines, or 2 weeks after a single dose vaccine, such as Johnson & Johnson's Janssen vaccine. Additionally, employers are required to communicate with employees on how to properly wear and perform seal check for these respirators. According to Cal Osha, employers can comply with the June 17th ETS by requiring face coverings for all employees while they gather documentation to allow fully vaccinated persons to go without face coverings. If an employer is unable to provide NIOSH approved respirators on the effective date of the ETS revisions, it is particularly important that the employer take alternative measures to protect unvaccinated employees until respirators are available. In terms of face mask requirements in the work setting, fully vaccinated employees in an indoor work setting is no longer required to wear a face mask. Fully vaccinated employees in an outdoor work setting is also no longer required to wear a face mask. Not fully vaccinated employees in an indoor work setting is required to wear a face mask. And then not fully vaccinated employees in an outdoor setting is not required to wear a face mask. During an outbreak at the work site, Cal Osha ETS requires all employees to wear face coverings indoors and outdoors when 6 feet physical distancing cannot be maintained, regardless of vaccination status. Also want to note that employees wearing a face covering or respirator are protected from retaliation. Next slide, please. There are additional key requirements in the updated Cal Osha ETS. Employers are required to document an employee's vaccination status. Employers are not required to retain copies. And if an employer decides to require proof of vaccination, please follow the California Department of Public Health guidance. Employees are also allowed to self-attest. Physical distancing not required for employees regardless of vaccination status. However, it is only required during a major outbreak. The third key requirement on the slide is that evaluation of ventilation systems are required for indoor work sites. Employers must evaluate ventilation systems to maximize outdoor air and increase filtration efficiency, and evaluate the use of additional air cleaning systems. Additionally, employers are required to screen employees for COVID-19 symptoms and also support isolation and quarantine. So what it means for fully vaccinated employees who are without symptoms, they do not need to be tested or quarantined after close contact with COVID-19 cases unless they have symptoms. Additionally, employers are required to mitigate and track employee COVID-19 cases and then report COVID-19 outbreaks to the Alameda County Public Health and also the City of Berkeley Public Health. Next slide, please.
ASL interpreters, please switch. Eileen, you can carry on.
Thank you. So here are the Alameda County and City of Berkeley outbreak reporting instructions. Employers must report workplace-related outbreaks to the local health department. The outbreak definition is 3 or more positive employee cases within an exposed group. Employers are required to track and keep record of all COVID-19 cases with employee's name, contact information, occupation, location worked, date of last day at workplace, and the date of the positive COVID-19 test. For Alameda County, please report workplace outbreaks via the California Department of Public Health shared portal for outbreak tracking. And then for the city of Berkeley, please report workplace outbreaks by calling 510-981-5292 or send an email that is provided on this link with the subject line Berkeley worksite exposure possible outbreak. The next requirement for employers is the California Supplemental Paid Sick Leave. Employers must provide 80 hours of COVID-19 supplemental paid sick leave for eligible employees who are isolating, quarantining related to COVID-19, attending appointments to receive a COVID-19 vaccine, experiencing symptoms related to COVID-19 vaccine, experiencing COVID-19 symptoms, caring for a family member who is subject to quarantine or isolation, caring for a child whose school or place of care is closed due to COVID-19. I'd like to note that these protections extend through September 30th, 2021, and it only applies to businesses employing more than 25 employees. Finally, there are California Department of Public Health guidelines for implementing patron mask requirements. In settings where masks are only required for unvaccinated persons, businesses, venue operators, or hosts may choose to do the following. The first option is to implement vaccine verification to determine if for which individuals are required to wear a mask. Second option is to allow vaccinated individuals to self-attest their compliance prior to entry. For example, it could be verbal, written, or acknowledgement of signage. The third option is to require all patrons to wear a mask. Also like to note here that no person can be prevented from wearing a mask as a condition of participation in an activity or entry into a business. Next, I will turn it back over to Dr. Moss to cover local recovery and resilience.
Thank you, Eileen. So you've been hearing a lot about the changes in restrictions, where things stand now. What about what we'll be doing at the county in the coming months as we've moved into this next phase of the pandemic? So these are our goals, and they've been in place for our goals for the pandemic, and they've been in place for a while now, and they are going to continue. We still have COVID, and we still have a job to do in the public health department and healthcare services. City of Berkeley is a separate health jurisdiction, but we are very much in alignment on these goals, preventing COVID transmission. As we move away from these broad-based restrictions, vaccine becomes the most important tool here, but there are other parts to prevention. Testing and making sure that people isolate if they're sick, supporting people through COVID, addressing the COVID health disparities, and continuing to work to improve our public health infrastructure as we respond to COVID and prepare for future threats. So, these things really do continue. And within each of these areas, next slide, please, we have many strategies. Now, don't worry, I'm not going to read through all of these. But I think it's just important to note that as we move into this new period of less broad-based restrictions, we will be focusing even more on our bread and butter public health and local health work, and on supporting our communities to recover from the pandemic and to be resilient against future threats. So lots of work left to do for this pandemic, and as we turn as a community towards the future. But one thing that we are doing less of is really interfering with businesses and employers' functions and operations. And there are not additional county restrictions that are being layered on at this time. We've really been moving with the state since the end of 2020 and are going to continue to do so. And that means employers really will have flexibility to determine a lot of how their operations are going to work in the short and long term here. With of course the Cal OSHA restrictions and the few remaining state COVID restrictions that are in place. Next slide, please.
Dr. Moss, can you please pause? We've lost our ASL interpreters.
Sure, I'm seeing one.
Are you?
I'm seeing Pamela.
Okay. If anybody has not seen an ASL interpreter, please put that in the Q&A. Thank you, Dr. Moss.
So, so there are some important things that we are asking employers to do, simple things to support in our communities to help continue to limit the spread of COVID. So one really important thing is really reminding and encouraging people to stay home when sick. That's good for your workforce, and it's good for the community at large. And so please be supportive of workers. And that's the same for employers as well. You know, I know the work never stops, but it is important for people to stay home when sick. Hand hygiene will continue to be important. We didn't have as many colds and flus to deal with last year because social distancing is not just good at limiting the spread of COVID, but it limited the spread of those other bugs. And we're going to start to see those again. Washing hands is great for COVID and great for those things as well. Of course, making sure that the right mask rules are being applied and making sure that unvaccinated people are masked up is very important. Increasing ventilation as best you can. Fresh air is great for COVID. Hopefully we won't have too many smoky days this year. Support workers who need to be out of work for isolation because they have COVID or quarantine. Of course, we want to support people to get vaccinated. And stay up to speed on the Cal OSHA regulations. They will change again, I'm sure. So that will be important. Next slide, please. So I just want to, over the next slide, just share some resources. These are things that you can look at for additional information. We should have these links available on our website. Cal OSHA has a for those who haven't read them, the regulations can be a little dense, but their frequently asked questions are very useful, organized by topic. They've updated those. They have a list of vendors to get respirators from, and the respirator training video is up at this link. I know there was a question about that. They have their own training tools for these regulations. The state also, the California Department of Public Health, a different department at the state, has some useful toolkits for employers about vaccination, including how to support your workforce to get vaccinated and other things to support moving beyond the blueprint. Next slide, please. There are many resources. I won't go through all of these. But you can find them on ours and City of Berkeley's websites about how to get vaccinated. Next slide. And there are different places to get updates and information, sign up for information, including our county health services agency newsletters and updates, our vaccine community advisory group, and the state has a lot of resources. So lots of different places to look for information going forward. And I believe that's the last slide before the questions.
Great. Well, thank you all for the panel, for the great overview. covering lots and lots of topics. The good thing is we also have a good amount of time now for some questions and answers. And so I do want to keep moving through our slides. A number of you submitted some questions in advance. And on the next slide, I believe we have some questions about masking. So why don't we turn our attention to those if we can. If we can advance it to slide 34. We've got, I think, 4 or so questions about masking right now. The first question, which I'll read as the slides get caught up, is can we continue to require that everyone, including customers, wear masks? This sounds like it's probably from a business owner. And I believe, Dr. Moss, you're handling a lot of the masking questions.
Yeah, that's right. You can require masks or face covering for everybody coming in. That's totally okay. We know businesses are doing that. Some have chosen to do that, and we're asking community members to bring a mask. And you might be vaccinated, but if you're asked, please put the mask on. So that's okay, and we want people to comply.
Great. We have another question also about masking, and it's about what are the guidelines on identifying employees who are vaccinated or not as it relates to mask wearing? And I think we got a similar question in the chat as well.
Sure. So, we really encourage people to work with their own counsel or HR, or if you don't have those, with your industry groups to, make sure you got all your T's crossed and your I's dotted. Cal OSHA does require documentation of vaccination status with this latest update, and they provide in their FAQs a little bit of background on this. And then the state public health department has also provided, and we can post a link to this in the chat, a vaccination record guideline document, which can help. So between what Cal OSHA is asking and the state's guidance, you should have plenty of resources.
I know we can all see, but I'm going to read that third question down, which is, can a medical office refuse to see or treat a patient if they refuse to wear a mask when they enter the office?
My understanding is that medical providers do have the ability to determine who they see and who they don't, up to a point. If they're Medi-Cal providers, for example, or within a large provider organization, they may be constrained by the rules of those organizations. So it is possible that this could happen. We want to support our medical provider community to find ways to serve all of their patients and the community members that use them the best way possible during this time.
Our last question here, and there's a couple more that I'll come to in a moment in the Q&A, but when will all employees be allowed to unmask indoors in Alameda County?
A good question. It's always been difficult to predict the future with COVID. I think it's encouraging that as a state we've got to a place where these many restrictions have been able to be loosened up. I don't know when we'll get to this next step. I think people are sort of holding their breath a bit as we open so much, and as we look ahead to the fall, which will be here before you know it, with cooler months. Still a lot of unvaccinated people. So I don't know the answer. I would continue to follow the Cal OSHA website closely, look and see. They have to post, they have a meeting schedule, and it takes a little getting used to, but you can look at their meeting schedule and look at what's on the agenda and get a sense when they're gonna revisit some of these rules. But I can't provide anything more definite.
Fair point. We do have a couple questions in the Q&A about masks, but I'm going to come back to those. We're going to move into vaccination for a minute. Dr. Hernandez, I know you'll be taking this section, but the first question, as you can see right there, can we imply our employees be vaccinated?
I'll give you a short answer, and the answer is yes. That is something that is allowed by Cal Osha.
And our second question on vaccination that was again submitted before tonight's webinar, are employers allowed and or expected to track the vaccination status of employees, and under what circumstances?
So that is what Cal Osha is requiring employers to do, is to know the vaccination status of their employees. And that's for the just general employees, as well as under the aerosol transmissible disease guidance as well. So there's certain standards depending on the type of business. And in both standards, whether it's for all businesses, which is the ETS standards, or the aerosol transmissible disease standards, which is also part of the Cal Osha standards, and that's for healthcare settings. Both of those, employers are expected to track the status of their employees.
Great. And then you see our next question. In an office setting where all staff present are vaccinated, how should we handle visitors such as mail carriers with unknown vaccination status?
This is going to be a business's decision, their judgment. They can require that any visitors, whether it's a mail carrier or someone from the general public coming in to do business, to wear a mask, or they can also ask for their vaccination status. And if that's their decision, and that is something they're allowed to do, is to ask for the vaccination status of those visitors.
Greetings. Before we move on to the next question, we need ASL interpreters to switch, please. Thank you, Stephen. You can carry on.
Thank you. We have one more question here about vaccine centers. Are there any plans for setting up mass vaccine centers again for the flu vaccine and or potential COVID-19 vaccine booster shots?
I think I can answer for both Alameda County and City of Berkeley on this. At this point, we may not be setting up mass vaccination clinics for the booster shots. We're hoping that at that point we will be at a phase where vaccine will be more available in other settings besides a mass vaccination type setting. However, we've had good practice and we know how to set up a mass vaccination site pretty easily. So we will see where we are in the pandemic and in the vaccination status during the time, if and when boosters are required. In terms of flu vaccine, we know that flu vaccine is readily available in many settings. And the City of Berkeley, and I believe Alameda County also does vaccination clinics that are more focused, maybe more community focused, and are not mass vaccination sites, but are definitely clinics that are supported or run by the jurisdiction, the health jurisdiction. So we will see the same activity as we've seen in the past for vaccination clinics for flu. And as I mentioned, for the COVID booster, if and when that's needed, we're hoping that there will be more opportunities in the community to have a vaccine available.
Great. I'm going to switch one that's not on the slide, but it's very much related, and it's came into the Q&A. And it asks, how does a company develop a quote unquote benefits of vaccine training if healthcare and wellness are not our expertise? So this sounds like a business that's not in the healthcare setting. They want to help their workers become more educated about the benefits. What would you say to them? I
would say one is to look at the CDC and the California Department of Public Health websites. As Dr. Moss mentioned earlier, there were he mentioned some of the resources that are there specific to COVID vaccine, but the CDC especially has great resources when it comes to speaking about the benefits of vaccination. So that's what I would say would be one of the resources that I would suggest business owners look at.
Great. And our last question up here, just are there any special provisions for long-term care facilities regarding vaccination of employees?
So as I mentioned earlier, long-term care facilities are considered healthcare work facilities. So they are required to abide by the aerosol transmissible disease standards. And that is also part of Cal OSHA standards. What is required by the state and their licensing body is that they continue doing testing for all staff if they're less than 70% of staff and residents are not vaccinated. If they are above 70%, then they do not have to do regular testing for vaccinated staff.
Okay, great. Thank you for those questions, for those great answers.
Sure.
You just mentioned Cal OSHA, and our next set of questions is actually about Cal OSHA, and I believe Eileen's going to be handling those. And you can see, Eileen, our first question here is what documentation requirements are in place for tracking employee cases and or vaccine status, and for what length of time, if known, are they required?
So for a case per Cal OSHA, employers are required to investigate COVID-19 cases and keep record and track all COVID-19 cases with the employee's name, contact information, occupation, location where they worked, last day that they were in that workplace, and the date of their positive test. And then as for vaccine status, the employer is required to document the vaccine status of their employees. However, it's unknown how long these Cal OSHA requirements will be in place.
Great. Our next question in this section, if we allow vaccinated employees in the office with no masking, are those who cannot be vaccinated being discriminated against?
So there are exemptions in the Cal OSHA COVID-19 prevention ETS. There are medical condition, mental health condition, or disability exemptions. And the ETS provides alternative solutions such as a face shield with a drape on the bottom if an employee has one of those mentioned conditions.
Right. And our last pre-submitted question. So in addition to their employees, are employers also required to evaluate potential workplace exposure for volunteers, independent contractors, and members of the public?
Yes, employers are required to evaluate potential workplace exposures for volunteers, independent contractors, and as well as members of the public. Employers are required per Cal OSHA to consider how employees and other persons enter, leave, and also travel through that work site.
Great. And Eileen, while I've got you, I'm going to take the liberty actually of grabbing one of the questions in the Q&A. And the question is as follows. Will Alameda County make available to employers a sample self-attestation form that our employees can fill out to certify if they're vaccinated or not?
That would be actually a good question for Cal OSHA, since it is a requirement of the Cal OSHA COVID-19 prevention ETS.
Okay, great. We also, one other question somewhat related, will workplace posters be available for customers, such as masks required for unvaccinated people, so that we can post with something official, or do we make our own?
The California Department of Public Health actually has a webpage with resources and posters for face coverings. So I would like to direct you all there to visit that page to get the information and posters that you need.
Okay, and I know I'm picking on you a lot, Eileen, but I'm going to throw one more at you and then we'll mix it up a bit. But is there any best practice or recommendation on how to differentiate who is vaccinated and not vaccinated, so as to be able to require enforcing anyone who is unvaccinated to wear a mask while indoors? Would issuing special badges to those vaccinated be a best practice or acceptable practice?
That's a really good question. So the Cal OSHA ETS doesn't provide that information on best practices. They only ask that an employer document it. So I think it would be up to the employer to ask employees to report their status and they have it recorded. But that would be also a good question for Cal OSHA as well, and hopefully that they could add that into their ETS FAQ for employers.
So I'm going to, speaking of the ETS, a number of you have mentioned it. There was a question at the top. Does the ETS have an expiration date or planned expiration date when we are expected to go back to completely quote unquote normal? I don't know if that's you, Dr. Moss, or Dr. Hernandez.
That would probably be me again.
Oh yeah, you again. Okay, go for it.
Yes, so it's currently unknown of when the expiration date is. I think that Cal OSHA still has one more opportunity to re-adopt a updated standard. So really unsure about when the expiration date will be for the COVID-19 prevention ETS.
Okay. Here's a question from someone who asks, is there language I can provide from ACH or state for my guests to help us explain why, as a young child-based business, we are still requiring masks at all time in the facility?
Do you want me
It
to
sounds like a childcare site perhaps, or a place where there's a lot of children. That's my read. So.
Right. And Dr. Moss, I guess you're doing the mask, correct?
Yeah, I can take this one. So I think the question was asking for sort of something to help explain this. You know, the most important thing is the state's face covering order, which is specific about use settings, and I think you could point to that and say, well, we're doing it for this reason. You know, the other important reason is just to make clear to people that there's no vaccine for people under age 12. So if you have lots of people who are under age 12 in your setting, it's very reasonable to to require masks for everybody, because that is an unprotected population, particularly in indoor settings. So those would be two ways I would approach it. If there's a need for more specific resources, I don't have anything to point you to right now, but you're welcome to reach out to us and we can see if there's anything else we can find.
And a couple questions in the chat too about N95 masks, and somebody asks, I understand employers need to have N95 masks available, but can employees still use their cloth masks?
I'll take a crack. Oh, there's Eileen. Eileen, do you want to answer?
Oh, okay.
Eileen needs the answer.
Yes, so per Cal OSHA, an employer is required to provide unvaccinated employees a respirator for voluntary use. However, an unvaccinated employee can choose to just wear a face covering and not use the respirator.
Okay. We've had a lot of questions about employees and about verification, and somebody asks, what are the implications for maintaining vaccination status for employees with the recent introduction of the digital COVID-19 vaccine record?
So I can start it, and Eileen, you can correct me if I forget something. I think the verification, the record that you mentioned is a great resource that employers could use to get the documentation of their employees, but they're still required to have notification or have documentation or see documentation of their employees' vaccination status. So that's another tool that employers could use to see their employees' vaccination status. Other options include actually seeing the card, seeing a picture of the card, or a note, I believe, from their physician that states that the employee was vaccinated. So I think the tool from the state is a great resource, but it's not the only requirement or way to document an employee's vaccine status.
We had another question about vaccination status and specifically about verification. And someone asked, can an employer delegate to a third-party provider to document an employee's vaccination status? I'm guessing, Eileen, that's probably you.
Sorry, Stephen, can you repeat that question again?
Absolutely, of course. If the question is, can an employer delegate to a third-party provider to document an employee's vaccination status?
The Cal OSHA ETS doesn't speak to it as a third-party provider, just that the employer documents it. So if you do have a third-party provider, that would be okay as long as the employer has all that information.
Right. There's a question that's come up, and I don't know who, this might be one that all of you want to say a little bit about, but there's a question about how do we comply with the EEOC May 28th guidance to keep employee vaccination status confidential on the one hand, and on the other, use that information to enforce unvaccinated workers wearing masks indoors. Any guidance around how to navigate those issues? I think there's sort of an allusion to HIPAA and about how you protect people's confidentiality and privacy, but then also support a safe workplace. And obviously that's why we're having this kind of a webinar, because there's a lot of nuances and complexities.
So knowing the vaccination status is not a HIPAA regulated piece of information. However, employers are required to maintain privacy of their employees' vaccine status. So I know it's tricky. I can't provide any specific guidance on that. That's why we ask that you speak with your human resources department and legal counsel if you have specific questions about that. But I can say that it is not a HIPAA violation to obtain that information and to hold that.
I don't know if the question was getting at this, but the idea that because as an end result of that, some people will be masked and some people will not be masked, does that somehow, is that, does that represent a privacy issue? And I can't point to any specific guidelines about how to manage this either, but I would say that to our knowledge, that issue has not prevented the guidance from being put in place. Certainly people who are, people may choose to continue to wear face coverings. And so I don't think you can infer somebody's status by wearing a face covering. Although in settings where only vaccinated people are allowed to go without face coverings, you can infer that they are vaccinated if they don't have a face covering on in a workplace. And and I think that is a simple truth of these rules.
And I think that the same questioner had a related ask or question about, are California employers required to accommodate for religious purposes, just like medical and mental health reasons, someone who's not able to wear a mask? How is that addressed?
I think EEOC may have commented on this. If they haven't, I would defer to your again, to legal counsel or HR to consult on the specifics.
Yeah, and then there's a couple of related questions that are coming up too. So one's asking us, can we comment on the masking face covering guidance for people with disabilities? There was guidance from the governors and California Department of Public Health in January that people with disabilities could be exempt if that precludes their ability to do certain things, and apparently it's reiterated in the June 15th guidance. So does anyone want to comment on how that plays into the sort of implementation?
I think I missed part of the question, but there are specific exemptions based on certain health conditions that are built into the state's face covering guidance, and so those apply. I'm not sure how exactly the language. I'm not sure how Cal OSHA frames it, but typically people are protected under federal law in terms of health exemptions to these kinds of things. So I think that would apply in this case.
Let's see, there's a couple things, lots more questions coming in. And I guess someone is asking a question about how to properly wear and perform a seal check if employers are required to train unvaccinated employees in respirator use. Does anyone want to take that?
I can take that. So during the last Cal OSHA hearing, when they approved this ETS, the Cal OSHA staff mentioned that they're going to develop a training video for employers showing how employees can properly wear a respirator and how to perform a seal check. So please visit the Cal OSHA website for their training videos.
Okay. Let's see. There are a few other things that are coming in. There's a lot of questions about different settings. Here's one asking about in summer camp and youth settings. I understand children do not need to wear masks outdoors, but do adults not need to either? I think that's already been answered with the previous previous comments and questions from our panelists. There is a question here, and I don't know if anyone has the answer. This is about the duration of time that records need to be held on to. And it says if employees provide proof of vaccination and the employers self-attest to so employees provide proof of vaccination to their employer and they maintain a copy. How long will employers need to maintain that information? And is there a specific guideline for that duration? And if the employee signs a form self-attesting that they have received a vaccine, how long do they have to keep any self-attestation or other documents?
Well, I will start, and then Eileen, if you've seen something different, please add or correct. My understanding from reading the Cal OSHA guidelines is that employers are not required to maintain the records. They're required to see the documentation. And I have not seen any guidelines, because it's not a requirement to maintain those records. I have not seen any guidelines on how long you must retain them, because it's not something they're expecting to do.
Okay. And this gets back actually into a records question in a previous reference that I had made actually, and it says, where can we find written information that asking for vaccinations is not a HIPAA violation?
I'll have to see where that is. It can be, I haven't seen it in the Cal OSHA ETS frequently asked questions, but I have seen it in California Department of Public Health's guidelines about vaccination status. So there may be a specific section in the FAQs for Cal OSHA, but I have not seen them.
I don't know if it's in this document, it might be, but I posted in the chat earlier the state vaccine records guidelines and standards, which includes some information for employers. I will say that HIPAA only applies to covered entities. It doesn't apply to all businesses, although there are other expectations of confidentiality for employers that collect health information, and employers may collect health information, and it's not specific to COVID. And so, there are some, certainly there are some expectations and rules for confidentiality, but it's not necessarily HIPAA unless you're a HIPAA covered entity.
Great. Here's a bit of a different question that came up a little earlier. We didn't have a chance to get to it before. Are there some kind of standard measurements we are required to follow with regards to evaluation of ventilation systems?
So the state has published ventilation guidance back in February, and I think that's a useful resource, and the CDC also has guidelines. It's generally, I think, fairly flexible because they're, a broad range of buildings, employers, facilities out there. And I'm not aware, I would point you to those documents to see. I'm not aware what they, what's there in terms of standards, but I will tell you, for most settings, that's not going to be, they're not going to be strict requirements, because these guidelines are meant to apply to, a broad range of workplace settings.
Okay. Great. I know we're getting close to time, but we have a few more minutes for a few other questions that are coming in. Actually, one person had a very helpful comment that I'll just share with those on the webinar right now. One company offered that they've implemented their own form for employees to sign that has 3 different options on it. One is that they're fully vaccinated with HR verification, kind of corroborating that. A second is that they're not vaccinated, and 3 is that they're declined to state. And basically, if you're either not vaccinated or you decline to state, you're being asked to wear a mask. And that individual claims that it's working out very well for their company. So just a point of reference on that and some input. Here's a question, and this gets more into, I think, probably turning folks back to their HR and legal teams. But there is a question: if employers are required to enforce mask wearing by unvaccinated employees, what should an employer do if an unvaccinated worker refuses to wear a mask? I think that's a pretty straight HR question, but is there anything else from a public health standpoint we need to say about that? Okay. We do have one person. This is kind of I'd be interested to hear what people may be doing right now, but it was something that one questioner asked is, situations that come up in the workplace when employees are in indoor group settings, and then all of a sudden questions start to ask about who's been vaccinated. Is it okay for coworkers and managers to verify verbally if someone has been vaccinated?
So employers can use self-attestation, and that can be verbal or written. So I think that's what an employer can do. Coworkers asking each other, I think that's sort of like conversation around the proverbial water cooler. That's something that coworkers can choose to answer or not. I don't think it's specific. That's a coworker to coworker type of situation, in my opinion.
Yep. Let's see. I think we've actually gotten through many questions here. One person asked about where there's information about disinfecting and sanitizing expectations, and that response is coming forward in the chat right now. There's some questions about signage and things of that sort, but I think more about standardization. I think one thing that I guess there may still be some lingering confusion about. So employers cannot confirm who isn't vaccinated, correct? So I think folks are wondering kind of this conundrum about they're being asked to validate who's vaccinated or who's not. But then there's this threshold question about privacy and what people are being willing to share or not. So any final words to maybe help clarify people's confusion about an employer confirmation and kind of protocols to keep both employers and employees and customers protected?
So employers are allowed to ask about vaccination status, and I'll see if I can. I think actually Dr. Moss already put in the section I was going to put in as well in terms of what Cal Osha state. So they are allowed to ask employees whether they're vaccinated or not. They're actually required to by Cal Osha, and they can require vaccination. So those are two different things. Asking about it, they're required to do by Cal Osha. Requiring vaccination is an option that they can exercise.
Great. We've only got time for one or two more questions, and I see one that's just come in. It's also related to ventilation, and it says Alameda County ventilation guidance said businesses should operate the HVAC for 2 hours before opening and 2 hours after. And the question is that only a recommendation and not a requirement? I think, Eileen, that's probably for you.
I would say follow the manufacturing guidance for the HVAC system. Sorry, I'm not familiar with HVAC and ventilation systems. Dr. Moss.
Eileen, do we still have our own separate ventilation guidance up? I thought we
shouldn't, and we should be referring folks to state and Cal Osha.
And I posted in the chat the state's ventilation guidance from February. That'll probably get updated at some point, but it's pretty good, pretty flexible. The CDC ventilation guidance for buildings, and also a link to Cal Osha's full ETS FAQ document, which includes a few questions about their ventilation. The language about ventilation in Cal Osha's ETS pretty limited, so it's fairly flexible, and I encourage you to all look that up and read it. But the FAQs can be helpful as well.
Great. So we've had a lot of great questions, and I think we're just about running through all of the critical ones that are coming up. I think the one theme that's come through a few that I haven't asked seems to be about this notion of uncertainty, either employees not being willing to or not being forthcoming with their status, people being in groups where there's no real obvious way to discern who may be vaccinated or not, customers potentially coming in. Is there any kind of parting thoughts or words of wisdom you want to suggest to our business owners and others out there who are trying to navigate this turn into the next phase of the pandemic?
I'll go first because I have a couple final thoughts that aren't final thoughts. I was asked to clarify one thing. So record of vaccination status is required, but proof of vaccination is not required. It's just that people who don't provide proof must be treated as if they were unvaccinated. And so I think it's just a subtle distinction where people who don't provide that information, they just are treated as unvaccinated. So that's one thing. And then another comment I wanted to make, I put it in the chat, but just in case there's people on this call for whom this is relevant to your operations, correctional settings, like healthcare settings, are also governed by the state aerosol transmitted disease standards, not these ETS regulations, different standards. So I would refer people to those for correctional settings. And we're happy to provide additional clarification on anything offline after the meeting. And then sort of switching gears to closing out, just wanted to say how grateful we are to the business and employer community of Alameda County, many organizations out there that have been regulated in different ways through COVID. It's been a very difficult year. I know it's been very difficult for certain businesses to just survive. We are just absolutely grateful and respectful of the sacrifices that people have made to get through this, to try to make things work, to comply, to support their workforce. We hope that better days are ahead with these changes, and we appreciate so much people coming forward and participating in these conversations and really supporting the health of our community members.
Dr. Hernandez.
I want to echo Dr. Moss' thanks to the business community. I know that this has been an extremely tough year and a half on the business community in the city of Berkeley, in Alameda County, and throughout the state. And it is through the sacrifices of the community at large, especially those in our businesses, that have allowed us to be where we are now, where we are able to open up fully. And it's also a testament of the engagement of the community and the business community with all the questions here tonight, because everyone wants to get it right. And I appreciate that. It really does help us keep the community safer. So again, thank you. And I appreciate the support to the public health community from the business community as well.
And Eileen, I know you've been busy there doing lots of things, and also usually are on the front lines of questions from our businesses out there. Is there anything you'd like to say as we wrap up?
Just quickly, I want to thank everyone for joining us tonight. And then I echo everything that Dr. Moss and Dr. Hernandez said. Thank you.
Well, let's give it up for our fantastic panel. They've done a great job, I think, of helping to give everybody the latest and greatest information about what have obviously been some very rapidly changing events over the last several months. And you can see here up on the screen a few places to reach out if you have questions, if you have general inquiries where they can go to Alameda County, or if you have workplace reopening questions, those also can go there. And if you're in the city of Berkeley, make sure to route those to the COVID-19 at cityofberkeley.info email address so they get routed in the right direction and you can get a quick and thorough and complete response. Before we go, I do just want to, in addition to thanking our panelists again, remind everybody that these slides, a recording of this webinar and the chat Q&A that was all put up will be posted up on the Alameda County Healthcare Services Agency website very, very soon. So look for that link shortly. So if you want to watch it or rewatch it or refer folks back to it or look at any of the things that we addressed tonight in the Q&A, we'll be able to do that. So with that, I want to thank everyone for being here this evening and joining both the county and city of Berkeley's public health groups. And we hope to see you again very soon. Take care.